My Lords, I rise very briefly, having, as already has been acknowledged, put my name to Amendment 63, tabled by the Noble Lady Baroness Whittaker, and 65, tabled by the Noble Lady Baroness Tyler. Both of them have done a totally comprehensive job in introducing them, so I will be extremely brief. I just wanted to say, the Noble Lady Baroness Whittaker is extremely well known in your Lordship's House for championing the issues, so many issues affecting Gypsy, Roma and Traveller people. But I did particularly want to sign Amendment 63 because I think it's a very broad-ranging amendment that for everybody to get culturally appropriate forms of explanation is crucial. It struck me actually as we were debating that we're focused now on mental health, but I think this probably would also apply right across the NHS to physical health as well, because there are also, of course, cultural differences in understanding our bodies, etc. But I was thinking about, if we think about, for example, the case, and this is an entirely imaginary case, but of a case perhaps of a refugee who suffers mental health difficulties, having fled their home country where they've been subject to abuse by the authorities in their home country, how important it is to make sure, if they are to be sectioned, how carefully that is explained and understood, both for the patient and potentially the patient's family as well, to understand that there needs to be an extra level and a sensitivity to the circumstances that that person is in. And we will all have different circumstances, but I think it's really important to look at it in that broad frame. And in terms of Amendment 65, we've already canvassed quite extensively the way in which minoritised communities are currently seeing very significant disparities in the way they're being treated under the law in the area of mental health, and particularly in community treatment orders. And so I think the Noble Lady Baroness Tyler described this as a probing amendment. Whether this is the exact means or not, it's clearly clear that we have to have much better data, and we have to make sure that as soon as trends and patterns emerge in that data, that they are acted upon. And it's encouraging to hear that this is being piloted and work is being done, but it's really crucial that this is something that just becomes absolutely standard, and that's why it's very tempting to feel that it really has to be on the face of the bill.